Oh, we understand. No, you didn't. No, you didn't. I'm gonna start developing descriptions for his warm-up routine. Okay, this is the Harley warm-up. He's doing the wrist. And then this is the Python. You know, he's doing this. Harley first, then Python. See, people love you, man. You're a media star, man. Greg, you're the star of the whole COVID-19, man. Still working on the tour t-shirts.
I was about to say, I still want the t-shirt.
I do too. I'm cutting the sleeves off mine though. If I'm going all out. Pulling out the Def Leppard bandana. I'm gonna put it on, you know. I was so bummed because Def Leppard was coming to the Brandon Amphitheater. I'm like, oh, I'm so there. You know?
Just have to make do with nobody.
Yeah, I'm sad about that.
Good afternoon. I want to thank everyone for being here with us today. Yesterday, we spent a great deal of time talking about testing. We know that we have a lot more work to do, and I am extremely proud, though, of the healthcare workers, of Dr. Dobbs and his team, and all that has gone into Mississippi being one of the states that is testing at a higher rate than virtually any other state that has not received significant federal help. You know, when you look at the hot spots in New York and New Jersey and even to our neighbor to the west, Louisiana, in the city of New Orleans, the federal government put significant resources in there to help them testing, understandably so, whereas they had a significant peak that went up very, very quickly. Mississippi appears to have, at least for now, slowed the spread of the virus, and we are becoming more and more confident each day that for where we are currently plateaued, that we will not be putting the kind of risk on our healthcare system as was the case in those hotspot areas. We're also seeing now that some of those hotspots are spreading out a bit. When you look at the Boston metropolitan area, the Detroit metropolitan area, and then to a certain extent the Chicago metropolitan area as well. Those are certainly have potential to continue to get worse and worse. We're praying for them and hopeful that things work out well for them. As where we find ourselves today, we are obviously having conversations about what a further reopening of our economy may look like. And I want to just offer a bit of a preview for the people of Mississippi. Understand that this is not going to be a light switch that we can turn on and off. There will not be one day when we return to normal as we knew it 2 months ago. So do not expect to wake up on Friday or next Monday or even the Monday after that and it be as if a light switch went off and that none of this ever happened. That is not reality. That is not what we are dealing with. Our reopening strategy will be continuous, but it will be slow. Opening up perhaps different sectors, perhaps maybe different regions of the state at different times as the data and the public health experts advise us. There will continue to be rules. There will continue to be rules that we will continue to need to follow. We will ease into it. We're not going to rush into it. But we understand that we have to start heading in that direction. We have to do something. Because for some, during this time, the wait has been somewhat comfortable. But for some, you have Netflix and you have food delivery. But for others, this is deeply, deeply painful. Please, all of my fellow Mississippians, please remember that. Please remember the hundreds of thousands of Mississippians that have filed for unemployment insurance just in the last 3 or 4 weeks. Many of them have never been on unemployment insurance in their life. And so they're frustrated because navigating the system can be frustrating. Although I will tell you, we as a state have made great progress, and we will continue to do so. Every opportunity that we have to give a lifeline to a worker by slowly reopening will help save lives in the long term. I truly believe that. But I also know that this virus is deadly. It is spreading, and it continues to spread. I am pleased, as I said yesterday, that our curve is flattening. It appears to be plateauing, and it appears it is going to be much lower than was originally expected. That's good news. And that happened because of you, because you've made good decisions. You've made the right decisions. But understand that does not mean that the threat is gone. I'm incredibly grateful for Dr. Dobbs and his team at the State Department of Health for their counsel and for their expert leadership throughout this crisis. We all know that Dr. Dobbs has been a steady hand on the wheel. We will continue to listen to our state's top health experts every step of the way. We know that the ultimate help will be when workers are allowed to provide for themselves. In the meantime, we want to offer any helping hand we can. Understand that there has been a press release that's gone out just recently from the IRS. And so this is critically important for those of you who are on Social Security. Again, this is a federal program that the state does not have necessarily a role to play, but I want everyone to understand this. I want to flag this for any and everyone on Social Security. If you are on Social Security and do not file tax returns, you need to take action to get the extra $500 per child payment on top of your $1,200 support from the federal government. You must go to irs.gov to do that. Let me say that again. If you did not file taxes, if you are on Social Security and you did not file taxes in 2018 or 2019, you must go to irs.gov to get that additional payment. That must be done by noon tomorrow. And so I'm hopeful that you are paying attention and that you will do that if you fit into that category. Again, it is not state-run. It is a federal program. But if you don't go to the website and file, you will not be eligible for that money if you have any dependents. Why is that the case? Because obviously, if you don't file tax returns with the IRS, it would be impossible for them to know that you have dependents. Now, today, I've also invited the team from the Mississippi Department of Employment Services to talk about unemployment insurance. We do have some good news, and I'm happy to announce it, that starting today, we have cleared the hurdles to make available the Pandemic Unemployment Assistance Program. That means that self-employed Mississippians, independent contractors, church employees, gig economy workers, and others who were not previously eligible can now get assistance. It also specifically lays out benefits for people who are not able to work as a direct result of the COVID-19 crisis. Now, please hear me say this. If you have previously filed and you weren't eligible for the typical unemployment, you do not have to file again. Fill out your weekly certifications and you will get notified if you are eligible for this special fund. As I have said here many times before, we are continuing to staff up and work to address the 14,000% increase in claims that has caused delays for the people. That work is ongoing. There is no simple fix, but I will tell you that I am proud of the efforts of these individuals at the Department of Employment Security. They are working day and night to continue to build capacity. At this point, I can tell you that we have increased the number of people answering the phones from approximately 50 to approximately 250, a five-fold increase over a few short weeks. When you looked at what happened last week in overall claims, what you saw is that Mississippi's processing actually processed approximately 50% more claims than the week before. That's because we're building capacity. If you look at what happened in America, the number of claims filed last week compared to the week before was almost identical. Now, some of you may believe that it was identical because there were not more unemployed people in other parts of the country. I don't believe that's the case. I believe that the capacity had reached a level 2 weeks ago nationally that, for all intents and purposes, was not increased. In our state, we continue to increase capacity to answer the calls so that we continue to minimize and mitigate the number of calls that go unanswered. And so I want to ask Director Turner and Timothy Rush to give us an update on what I believe to be very impressive efforts to deal with this unprecedented surge in unemployment insurance claims. Director?
Thank you, Governor Reeves. It's our pleasure to be back with you here again at this press conference. We had the pleasure of coming and being before you a couple of weeks ago, and at that time, we were able to announce that the additional $600 related to those that are eligible for the what we call the regular unemployment insurance program, that those payments were flowing. And in the 2 weeks since we've been here, we have paid out millions, and I want to give those figures. It's astronomical, and it tells the point, it goes to the point that Governor Reeves was talking about how the workload and the number of claims and the people working so hard every day to bring those Mississippians the benefits that they deserve, what we have been able to accomplish in those weeks. On a typical unemployment week prior to the pandemic, in this good economy, we may have paid out about $1 million a week. Last week, we paid out $72 million. $54 million of that was related to the FPUC, or Pandemic Unemployment Compensation, related to the Unemployment Insurance Program. Now, the 2 days of this week, we have already paid out $72 million, $880,000, and we have surpassed what we paid out all in the last 2 weeks, and that is strictly related to the extra $600 and the people filing and are eligible for the regular unemployment insurance program. So I'm pleased, as you are, that we've made great strides, but it's not enough until we reach every single Mississippian that needs our help. So we are also pleased today to announce the application process for the pandemic unemployment assistance portion of the CARES Act is now available through the mds.ms.gov website to file for the benefits that are due to those that, as Governor Reeves described, as the gig economy workers. You may also find yourself eligible if you were ineligible for the regular unemployment insurance program because of insufficient wages or other barriers. But because of a COVID-related reason, and there are 10 of them, and it's listed on our website, and they are listed in the application process, if you qualify for one of those 10 reasons and found yourself not eligible in the regular unemployment insurance program, you may be eligible for pandemic unemployment assistance. For a time, so the application process is now on our website, and our call center, our contact center representatives are available to take your claims through the contact center. We have added additional phone numbers. Please see our website for those additional phone numbers. We also have a specific call center number for pandemic unemployment assistance. Now, I'll say, I've asked that we can manage it better if you will call one of those options so that others can get through on the other lines. As Governor Reeves stated, we have added these people in line so that we can help others get to us quicker. So as I'll recap that, we have our normal call center number that's been out there the entire time. We added an additional call center number yesterday for additional people that can take your claims, and as we speak, a press release is going out, and information on our website and through social media, and we'll share it with our state leaders and our partners around the state that that the pandemic unemployment assistance is now available, and there's an additional call center number for that as well. I'll stop now and let Mr. Rush take a few minutes to talk about provisions, specific provisions of the CARES Act.
Before Mr. Rush goes, let me just reiterate that, please. There are multiple phone numbers now on their website. The best way for you to reach someone the quickest is to pick one of those numbers, stick with it, and call it. If you keep going from number to number to number, and I understand that everybody can be frustrated, but if you keep going from number to number to number, you're going to tie up those lines, and you're less likely to actually get someone to answer them. If we will patiently call the same number, give it a little bit of time if you don't get an answer, and then call the same number back. We are, again, building capacity to go from 50 to 250 people answering the phone over a short 3 weeks has been very good work, but we've got more work to do, and we know that. So, Mr. Rush?
Thank you, Governor and Director Turner. I'd like to say in addition to that, we have upped the number of phone lines to over 1,000. So we are trying to reach as many people and return as many calls and answer as many live calls as possible. In addition to the phone lines, we are, as indicated, providing now opportunities for individuals who are in the gig economy, who are self-employed, who may be working for charitable organizations or faith-based organizations, the pandemic unemployment assistance. We're hoping that will be available by the end of this week, and payments will go out as early as the weekend or Monday of next week. There is a specific number that we encourage you to call. As Director Turner indicated, that number will be posted on our webpage, and I would like to share that number at this time. That's 1-833-919-0334. That's 1-833-919-0334. And that line is specifically for those who are part of the gig economy, those who are self-employed, part of the faith-based community, those who are not covered for regular unemployment benefits. In addition to the FPUC, there is the Pandemic Emergency Unemployment Compensation program. So we have essentially 3 programs which most of the claimants have filed and received additional $600, which is under the Pandemic Unemployment Compensation. The Emergency Unemployment Compensation Program is for those individuals who may have had a claim prior to March of this year, and those benefits would have expired or ran out, or individuals who have exhausted benefits or in a current benefit year and are not able to receive benefits as a result of COVID-19. If you file your claim, there may be a notice on the system indicating that you're not eligible because you've exhausted benefits. There is no need to file an additional claim. The system will notify you of your eligibility for benefits. It is important that you do file the weekly benefit certifications. We've noticed that quite a few individuals have not filed the weekly certifications, and we encourage individuals to go in each Sunday morning or each Sunday and file the weekly certification. That's how you get paid on the debit card or either direct deposit. I'll yield at this point and entertain any questions if there are any.
Okay. We will we'll come back to questions in just a second. I'm going to give Dr. Dobbs the opportunity to bring us up to date on where we find ourselves with COVID-19 in the state of Mississippi, and then we'll open it up to questions. Dr. Dobbs?
Yeah, thank you, Governor. Just a quick update. We reported 204 new cases with 14 additional deaths, sadly, bringing us to a total of 4,716 cases and 183 deaths. Of note, 90% of those deaths are in individuals over 60 years of age. 51.3% of our total case burden is in African Americans, and 64% of our deaths are among African Americans. As of yesterday, we had completed a total of 52,364 tests for Mississippians. Still wonderful progress by the public health lab, and then also to the private docs and clinics have done a fantastic job. As far as hospital capacity, yesterday, updates report we have 79 COVID patients on mechanical ventilation with 668 available ventilators. COVID ICU patients, 144 with 277 open ICU beds. Again, with relative stability, some mild fluctuations, but the ventilator number is the lowest we've seen in a little bit. A couple of just quick messages to share. We have flattened the curve, which is fantastic, but we still haven't dropped. So there's still a lot of cases out there, so now's the time to be vigilant. We don't need to let our guard down. Make sure when we're in public that we're wearing masks, that we're maintaining social distancing, and although we are looking to try to grasp some sense of additional normalcy, we just really don't need to let our guard down. Your individual behavior is the most important thing that's going to protect you from COVID. A couple other things, we are working diligently with the medical and dental community to try to find strategies for eventually improving access to care. So that's something that will be evolving, and certainly appreciate the guidance from the governor's office as we sort of work through that process. As we look to the future, we are very worried about ongoing high-risk outbreaks. There are a lot of environments such as long-term care settings, nursing homes, places where people live in close proximity. Anticipate seeing more outbreaks. That's part of what we're concerned about. It's also part of what's being seen nationally, and so that's certainly going to affect our numbers as we go forward. Speaking of outbreaks, certainly we know that in some of these scenarios, businesses will be affected by cases or outbreaks. We will be putting on our website additional guidance for businesses so they can understand what to expect when maybe one of their employees is infected, or maybe one of their employees needs to be placed on quarantine orders to make sure they have a clear understanding of how long they will be out of work and they can make plans to that effect. We have put additional data on our website around long-term care centers if you haven't checked. We're trying to give as much information we can as by county, number of deaths, number of cases, by race, so that's information that you now have available to you. And then just lastly, please know that we have one of our major focuses making sure that we try to reach the African American community regard to testing, messaging, access to care. We know how important that is, and that's going to be a major focus of our effort as we go forward over the ensuing weeks. Thank you. Thank you, Governor.
Right. Well, thank you, Dr. Dobbs. And let me just reiterate something. I sat here yesterday and made the case to the people of Mississippi that the fact that we had gone from approximately 180 cases a couple of days towards the end of last week to 300 cases yesterday was not a reason to panic. Let me make, for consistency's sake, the exact same argument today that the fact that we went from 300 cases yesterday to 200 cases today is not a reason to celebrate. The reality is there are large variations from day to day. New testing results on a daily basis is not a perfect thing to look at because we know that we have delays in testing results, et cetera, and there's not a consistent test whereby we're getting these results in 15 seconds. And so what I would simply say is we are in the same posture today as we were yesterday, which is the same posture we were in the day before, even though the actual number of tests that we're reporting have varied greatly. The reality is that we are still in the plateau. We are still in the eye of the storm. And the most important thing that every Mississippian can do is to use common sense. Stay at home if at all possible. When you leave, go to work and go back home. If you need to stop and get groceries, wear a mask in the grocery store. You know, as I talk to people all over the state, what I'm repeatedly told is that in many employers, particularly the larger employers around the state that are open, they have instituted very significant measures to protect themselves and protect their employees. You go to large employers and everyone's wearing a mask and everyone is practicing great hygiene. But if you go to Walmart, maybe 1 in 5 or 2 in 5 Mississippians are wearing a mask. And so I think That's something that we want to continue to encourage. That is something that Dr. Dobbs has been very adamant about over the last several weeks, because again, the most important thing you can do is be smart and take care of yourself. And if you do that, then you're going to protect not only yourself, but your kids, your mom, your dad, your grandmom, your granddad, and all Mississippians. And so if we can all do this together, if we can all make these additional sacrifices for a few more days and weeks, we're going to be able to get our economy going again and get back to what may be a new normal, but certainly more normal everyday activity for Mississippians. So with that, I'll start over here to the right. Scott.
Governor, can you expand on the expanded unemployment benefits that are now going to be available? Exactly what type of people could now get that money who perhaps were not able to?
So the Pandemic Unemployment Assistance Program, basically, and these two to my right are far more knowledgeable than I am, so I'm going to put it in terms that I can understand, that hopefully helps everyone else understand. If you are self-employed, you are now eligible. If you are an independent contractor, you are now eligible. A pending eligibility verification, of course, by the department. But these are subsets and these are groups that would not necessarily have been eligible for state unemployment. But because of the CARES Act, because of this pandemic, this is like disaster unemployment assistance. So if you are self-employed, if you are an independent contractor, if you are employed by a church, a religious entity, or a nonprofit organization, if you are employed in the gig economy, if you have insufficient earnings to establish a regular unemployment claim, and if you are not eligible for regular unemployment compensation or extended benefits, you may be eligible for what's called pandemic unemployment assistance. And if you are eligible for pandemic unemployment assistance, you may also become eligible for the additional $600 as well.
Dave Elliott from WLOX has a question. Dave? Dave? I guess he can't hear us. Chelsea Brown from WTVA has a question. Chelsea?
Cases. They went from 75 yesterday to 95 reported today. Is there a reason that we are seeing Monroe County such as a hot spot for the coronavirus cases?
I missed the first half of the question. I'm so sorry.
Yeah. Could you repeat your question, please?
Yes. Monroe County has seen a spike in coronavirus cases. Yesterday they were at 75 cases, and today they went up to 95. That's a 20-case jump. And I was wondering if there has been any correlation with testing, or maybe if there's just a reason as to why Monroe County has seen so many cases within the past week.
I don't have the specifics around Monroe County. Certainly we can get additional information for you. A lot of the trend data is available on our website. Some of it's going to reflect testing delays that are intrinsic in the system. But certainly we're still seeing a lot of cases, and a lot of times outbreaks are going to have major impacts on our day-to-day variations. But we can please get with us offline, and we can answer that question a little bit more specifically.
Thank you. Courtney?
I know that we talked a good bit about testing yesterday, but can we go back to that just a bit? You guys mentioned some things about looking towards serology and some of that, as well as more rapid testing. How important are both of those pieces as you were advising the governor about when might be best to reopen the state's economy?
Well, there's going to be a lot of indicators as we go forward, and testing is certainly is a huge piece of that, but we have other indicators we can use as well. As far as serology, there's been a lot of excitement around serology, but there's also a lot of doubt. Professional guidelines have basically stated that right now it's not reliable. It's certainly not probably useful for diagnosing people who are sick right now. It eventually will be able to say who probably had it in the past. And really it's advised really more for surveillance purposes to understand what the epidemic was like in retrospect. and then also perhaps to clear folks in the future for work who might have been exposed. It's still an unknown. We're working closely to try to figure that out. I will say, to the healthcare system providers, please don't buy the cheap handheld tests. They're entirely unreliable, and certainly it's been. I really wish they hadn't been sold if they hadn't been validated by FDA. Serology is really going to be a question mark going forward, but a promising one. As far as access to testing, it's going to be very important. Like we mentioned before, if we really want to get ahead of outbreaks, we need to know what's going on immediately. There's different types of rapid, right? And certainly we would like to have access to immediate results. I have some feedback that some of our health systems have been able to have a minor increase in the number of rapid tests they have available to them. We're working to get rapid testing to local communities with high impact areas of transmission. But it's so modest because our federal distribution is extremely low. But hopefully that'll change in the future. It's embarrassingly low how much rapid testing's been made available to us at the federal government, but we're going to work hard to try to make that better.
Yeah, I will just tell you, we think testing is an important piece. You have heard a number of people, primarily on the other side of the aisle, governors from other states, act as if testing is the only piece to deciding when to reopen the economy. It is not the only piece. It is an important piece. We've seen testing as critically important in Mississippi, at least, since the beginning. It's the reason that when you take out New York and New Jersey and Connecticut and Louisiana, Mississippi has, in terms of per population, one of the highest test rates in America because we believe it's critically important. It's going to be even more important as we are having conversations internally right now, and there was a meeting that just took place today, and I think Dr. Hayes is over in the room where he's leading our effort with Dr. Dobbs and others in talking about elective surgeries, for instance, and medical procedures. This is something that we think is very important that we get open as soon as we possibly can, but if and only if it is done in a responsible and safe manner, and that's why the docs are leading the effort on that. Because they certainly understand the safety precautions and safety measures much more so than any politician ever will. But we think that we have been a leader nationally when it comes to testing. We're going to continue to lead. We're going to continue to find ways. And the way we've been a leader is not looking at things as either or, but looking at it as both and. And so while we need to continue to build capacity with the traditional testing method, we need to continue to look for capacity on those 15-minute tests, of which we have not received a significant number. Hopefully, production is going to increase dramatically, and hopefully, we're going to be fortunate enough to get a higher percentage than what we're getting right now of what little bit is being produced. But that's going to be part of the solution. We've got to have a multiple-pronged approach to continue to get a lot of testing. But as you know, I will also tell you, I mean, there are those, and I've heard them say it, there are those who believe that basically we can't open up our economy until every single Mississippian can get tested every single day. That's just not realistic. That is not a realistic goal, because for those who believe that, their states are going to be closed for the next 3 or 4 years. And they're not ever going to open back up because they're not going to have any people there to open back up. And so, you know, we are looking to do everything we can. We had a group of members of my team and some folks from Dr. Dobbs' team participate in a call today with the White House and looking at some of their suggestions on testing. I'm hopeful that was fruitful. It happened in the last hour, so I haven't gotten a report yet. We had a call yesterday with Vice President Pence and the Coronavirus Task Force in which testing was a topic that we discussed, and I know they're working hard, and we're also working very hard. But it is important. It is not the only important factor, but it is an important factor to making these decisions. Yes, sir.
Maybe for Dr. Dobbs. Started testing on college campuses, JSU and Tougaloo, I believe, over the weekend. You know, why, if students aren't in class right now, or B, are you planning on expanding college campuses, and why?
It wasn't the college campus itself that was important, but it's the location. it's really for the community. And so we're trying to get testing to communities in need. We will continue to do that, and sometimes it might be through drive-through testing mechanisms, but sometimes we may try to find other mechanisms to get testing out there. Certainly, the community health centers have really ramped up testing, and that's fantastic. Would encourage folks who don't have access to care, or maybe if you're one of the folks who are being cared for there, seek testing there if you need it. But we have so many partners across the state. We're really just extremely fortunate to have all these avenues. Sincerely, our healthcare system has been the hero in this testing success.
Yes, sir.
Governor, Nissan has obviously put production on hold. Same thing with Toyota. But Toyota recently announced that in May they were going to open up their production line again. Have you spoken to any of the local heads of the two to see if Nissan's going to do the same?
We have been in conversations with business leaders throughout the state, particularly and in specific some of those very large businesses. And reality is that that they're going to do what is in not only the best interest of their employees, but is what is in the best interest of their shareholders. And the fact is that worldwide demand for new automobiles has declined over the last 30 days. But I will also tell you that and we had a conversation about this yesterday, when you go from state to state and you look at those states that have completely shut down everything in their economy, including new automobile sales, used automobile sales, et cetera, as you can imagine, the sales in those states are down significantly more than they are in those states that have tried to responsibly allow those individuals who are working outside to do so in a way in which they're socially distancing, et cetera. And so we're going to continue to work with all of our employers, our large employers, our small employers, and do everything we can to get people back to work as soon as possible. We go back to Dave Elliott, maybe. Dave, I can hear you now.
Dave, you're live.
Oh, Governor, a comment and then a question. The comment Ms. Turner may want to respond to. That number you have for the pandemic unemployment assistance, I just tried to call it 12 times, and I was not successful. But here's my question for you, Governor. From the Northeast to the West Coast, we're seeing regional plans to start reopening the economy. Georgia, Tennessee, South Carolina, and looks like Florida, announcing some bold moves, maybe beginning Friday or Monday. Governor, do you kind of see yourself following the lead of some other Southern governors who might be like-minded in terms of reopening?
Well, thank you for that question, Dave. And Dave, quit calling that number. You're tying up the line. Other people are trying to get in. But yes, we had a great call over the weekend with our fellow Southern governors from Florida, Georgia, Tennessee, and Alabama, Governor Ivey in Alabama. We had a great conversation. All of us are of similar minds. We each have different circumstances and different situations that are unique to each individual state. But I do think it's very clear. And obviously, we actually moved first last week by reopening beaches for those communities who wanted to, by opening fishing on lakes for those who were responsible and wanted to do so, and also by allowing curbside sales for small business owners throughout the state. And so I'm not at all surprised, as this is sort of exactly what I anticipated occurring, with some in the South continuing to work to reopen. And I think you'll certainly see us continue to have conversations as to what that rollout looks like. We want to do it in a responsible, safe way, but we also want to make sure that we get as many people back to work so that they're providing for themselves as best as they can. So, yes, we are working together. We are in conversations. I spoke with many Republican governors late last night again. We spoke with them on Sunday, I believe it was. We may have had a call on Saturday as well. The days are kind of running together, but yes, we are working closely together, and we'll continue to do so. We have some challenges, particularly, Dave, down where you live, because of the major spike in cases in the city of New Orleans. That's a little bit unique to many in the Southeast, and we've got to recognize that, and we've got to deal with that in a different way, say, than maybe some other state that doesn't have New Orleans within 30 or 40 miles of their border. But yes, we are working very closely with them.
Emily from AP has a question. Emily?
Thanks. This is for Dr. Dobbs. I wanted to follow up a bit on some of the questions that another reporter asked yesterday about the contact tracing for coronavirus cases. Does the health department need to hire more employees to do that? If so, how many new employees and what would it cost?
We are steadily adding new members to the team, and this is a 7-day-a-week sort of endeavor. So it takes a good bit of folks to make sure we can keep that running smoothly. We have around 180 people now. A couple weeks ago, we had like about 140, or maybe even about 10 days ago. So we are increasing our workforce. Probably would like to add another 20 to 30 over the next week, and so we're working to do that. As far as funding, these folks are being deployed under orders with FEMA, and so it's part of the response that's being funded in that mechanism.
Yeah, and Emily, I'll just say that we've had multiple conversations, and this is a growth pattern that will continue as we move over the next several months. I am fully supportive of their efforts to improve and increase the number of individuals that can contact trace. I would not be surprised to see the CDC also deploy additional personnel out to the states to help with that, but it's got to be state-led, and we will find the resources either through the Stafford Act, which is the federal law which allows for the FEMA to reimburse large numbers of expenses when there is an emergency declaration, which we have in Mississippi, and we also have CARES Act money, and these are obviously dollars that will be eligible for the CARES Act, because these are things that we would not have been increasing employment to deal with the pandemic unless, and of course, the pandemic had occurred. And so we'll work with Dr. Dobbs and his team to continue to build capacity there as well. You follow up, Emily?
Yes, please.
Sure.
It's not clear to me, are these new employees or are they existing employees for some state agency that are being sent to do new duties, new responsibilities?
It's a combination. I don't have the entire breakdown. Most of them, a lot of them are health department employees that have been reassigned. It's important to know that there are certain skill sets that need to be there and certain technical capabilities. There are certain software programs you need to have expertise with and that sort of thing. So there is a bit of a learning curve. So when we can recruit people who are doing other stuff that have familiarity with it, it helps us really kind of run fast. And that's what we did initially when we assigned these teams. We have been steadily adding contract employees and others and hiring new individuals to sort of fill out these teams. So we'll almost certainly have to do more and more of that as we ramp up the number of folks doing this.
So in short, what I would say is much like the answer to Courtney Ann earlier, it's not either or, it's both and so it's a little of both. And will continue to be, I'm sure.
Joey Barnes from WCBI has a question. Joey?
Yes, my question was for Dr. Dobbs as well, and returning back to Monroe County. On the State Department of Health's website, there lists 7 long-term care facility deaths. I'm told there's now been an 8th, and 7 of the 8 have come from one facility. So my question is, at what point does the state step in, if at all, to tackle some of these issues where there are high death rates in long-term care facilities, if at all? And what would those steps be?
Yeah, great question. Thank you. So, this is something that we knew, going back 7 weeks ago, that this was going to be a problem, and certainly appreciate the long-term care industry for being responsive, trying to keep it out, because once you get an infection within the long-term care setting, it can be very difficult. It's something that we take extremely seriously. with every outbreak, we are actively involved, both from our licensure folks and also to our epi response teams, with guidance, helping them find pathways to protect their folks, making sure they're doing proper protective equipment. We do supply them with protective equipment as well, and guidance on cleaning and stuff like that. But we are certainly going to be additionally more involved as far as like ensuring cleaning, and what we would like to do, although we are doing a lot of testing around individual outbreaks. It hasn't been 100% penetration, and that's the next thing we really want to work on, is making sure that when we do have outbreaks, especially in long-term care, that we do extensive testing and we can find out at a point estimate who all might be shedding, and that'll help us. The one thing that's very important about this is, we did cut off visitation for folks, which I know is very hard, but it's been very helpful. It would certainly be a lot worse than this. But it's so important for employees to stay home when they're ill, and because they have to get in there somewhere, right? The residents aren't coming and going. So it's very, very important for people who are ill to not go into work and potentially spread this disease.
Thank you. Do you think that isolation wings within those facilities work whenever there's already been, I think, if I'm looking here correctly, 31 cases at 2 long-term care facilities there in Monroe County? There
are different strategies, and certainly cohorting does make a difference. And certainly the folks who are sick, a lot of them are removed. They're hospitalized or taken out for safety reasons. This is something that we have a lot of familiarity with in regards to flu outbreaks, other viral outbreaks, and GI tract infection outbreaks. If we're pristine in our response and make sure that we have folks cohorted properly, doing proper cleaning, proper protective equipment, we don't have any sort of social events and people eat in their rooms and that sort of thing. It's just like being in a hospital. Right, so you'll be hospitalized with folks in certain rooms who have it and some who don't, and we have the full expectation that if we do the right thing, it's not going to spread from room to room.
Scott?
If you lift the shelter-in-place order Monday, how do you see restaurants getting back to work, or do they still continue takeout only for weeks after? What do you ballpark think?
Well, we're having conversations about that right now. I think that whether it's on Monday or the following Monday or the Monday after that, what we're going to be looking at, I would presume, and if I were a restaurateur, what I would be thinking about is even if we reopen in-room dining, we will do so in such a way that allows for far fewer people in the restaurants. And so if you, for instance, had a capacity according to the health department of 100 in your particular restaurant, we may open back up at half capacity or a third capacity, or we're talking about the possibility of removing every other table, or the potential for ensuring social distancing continues to occur amongst individuals and amongst parties. No decision has been made with respect to any of that, but we do know that is an industry that has been particularly hard hit in this particular pandemic. They've been hard hit in terms of their overall sales. They've also been hard hit because many of their employees have had to have been laid off, and it's going to be hard for them to significantly increase, and this is true of the tourism industry as well, for them to significantly get those individuals back to work as quickly as we would like for them to. There may also be additional guidelines with respect to for instance, what the individual employees are, what's required of them in terms of ensuring that they are have hand sanitizer, perhaps if they're wearing masks or otherwise, things such as that we're having those conversations right now. We're not ready to make a final decision on them, but there is a plethora of options and conversations going on as it relates to that. Again, as it relates to restaurants, it's the same as it relates to the entire economy. We want to open them up as soon as possible, as soon as it's safe to do so.
Ashley Norwood from MPB has a question.
Great.
Ashley?
Hi, good afternoon. Can you guys hear me?
We can.
Okay, awesome. Question here. So According to what Dr. Dobbs has just said and what the department is reporting, African Americans are continuing to represent more than 50% of the infection rate and death rate. My question is, how concerning is that, and what's being done now to address that?
It is extremely concerning. And this is obviously not just a Mississippi issue. It's a nationwide issue, but it certainly is an acute issue within Mississippi, and it's not something that we find remotely acceptable. As far as like what's happening, we do have a fantastic team led in part through Dr. Sutton and his division at the Department of Health, working with multiple folks, both local leadership, working with HBCUs, working with a faith-based community, working on a communications mechanisms. We're doing a statewide survey of perspectives with a focus on African American understandings of what they feel is important to them from COVID. So we've got a whole bunch of things going on. We are doing testing locations within areas that are most impacted, and we're also trying to deploy other resources such as our rapid testing capabilities in areas that have most been impacted in the Black community. So it is absolutely one of our main priorities, and it will continue to be for obvious reasons, not just because it's the number one demographic group that's been impacted, but also too because of these historic health disparities. We know how vulnerable some of these communities are, and it's really our job to make sure we reach them as much as we can.
Right, and I think I would just reiterate what Dr. Dobbs said is incredibly concerning to he and his team, to me and my team. We are looking at it. It is fair to say this is not unique to Mississippi. In fact, Mississippi is the same as the other 49 states as it relates to this. Some of the things that we are contemplating, and we're continuing to scale up on the testing sites in African American communities is critically important. As has been said, we did Jackson State over the weekend. We're doing Tougaloo here in the Hinds County area. I've been in conversations over time with the mayor of Jackson and other African American leaders around the state, preachers that have come here and asked folks to be careful. There's no question that when you look at the demographics and you look at the health challenges in the African American community, that certainly puts them at a higher risk. That's not something that's happened in the last 10 or 15 days. That's something that's happened over the last many years. And so we've got to continue to work to fix that. We also have to continue to work to communicate and make sure that the messages of encouraging social distancing and other things are actually getting out to all of the people across Mississippi. And we're continuing to find creative ways to do that. And we will continue to do so.
Anita Lee from Sun Herald has a question. Anita?
Yes, thank you. I wanted to ask Dr. Dobbs and following up on Emily's questions, what triggers contact tracing? For example, could you give us a scenario of a certain number of cases, or the type of scenario it takes to get this done? Now to contact trace everywhere. What kinds of cases are you looking for to trace? Please describe what that looks like, and please tell us some of the locations where this is happening. And lastly, please give us a specific number of people you think you would need in this field to successfully do contact tracing statewide.
The first questions are pretty easy. Anybody who has a positive test gets tracked, right? So it's everybody. Anyone who has a positive COVID test, what we will do is we will contact them, make sure they're served, educated as to what's going on. make sure that they have the isolation order to make sure that they understand and are following the rules not to spread it. Probably even more important to that is then this next phase of quarantine. And so anyone who's had more than just a few minutes of close proximity and unprotected, if you're in protective gear, it's a different thing, but if you're in a social environment around somebody more than 10 minutes within 6 feet of someone who's actively and contagious with COVID, then you would likely be placed under quarantine order. And so we investigate everybody who falls within that criteria, whether it's in the home environment or whether it's in the work environment. So you can imagine that's pretty labor intensive. As far as like where are we doing it, we're doing it everywhere. We've got across the state. We have a county health department pretty much everywhere in the state, and so we have a presence throughout the state. And so no matter where you live in Mississippi, they're not all centralized in Jackson. We do have teams out in 9 different areas around the state to make sure that like Biloxi and Hattiesburg and Macomb and over there. So that's good. As far as how many we need, it's really a tough question. At this stage, we have to sort of scale up based on the need. We have about 180 folks working right now. They're able to pretty much within a day or two complete the initial phase of the investigation. So long as we're able to keep up with it, it's good. Hopefully we'll need less. We'll have less cases and won't need quite as many. But we're making sure that we sort of ramp up, make sure that we have access to resources, add folks on who can do the work, and then if we need additional support from CDC, we're glad to have that as an option that we can maybe utilize. So it's hard to know. We'll certainly need more.
Well, and I think this is a good opportunity to point out, every single day the total number of cases in Mississippi, by definition, are going to go up. Best case scenario is they go flat, which means we have no more new cases, but they're never going to go down in terms of total number of cases. But what you have to realize is some of these cases that we announced 4 weeks ago, these people are now recovered. Many times they're back in the workforce. And so the total number of active cases is a more important data point, which of course the Department of Health has. The active cases is a more important data point in terms of determining how many individuals you need to do contact tracing, because there's no reason to do contact tracing on someone from 4 weeks ago that has gotten it. We have done contact tracing, and that person and all the people that we found that were within their inner circle that have been contacted, now that they are beyond their 14-day period or have recovered, well, they kind of fall off the chart, we think, in terms of necessity to continue to do that, because we think that once you get the virus once, that it's not likely that you would get it again. Again, I'm not sure that anyone's willing to die on the sword on that particular data point at this point, because we don't have it done, but we believe that to be the case. Is that fair?
Yes, sir, absolutely.
I'm already getting some questions about the pandemic unemployment assistance. For those who had already filed, they didn't qualify for the regular unemployment. They're saying, well, we file our weekly certification. How will we know once it has been processed to know whether or not we qualify for the pandemic unemployment response? Will they get some type of communication that will let them know yay or nay?
Yes, I'm glad you asked that question, because I was going to make that point before we left here today. If you have already filed and been denied for unemployment, that you do not have to file another application. Let me back up and say, we announced today that the application process now has, in addition to the regular unemployment questions, we have added the pandemic unemployment assistance questions. It is not a separate application process. It's embedded into the regular unemployment. So to answer your questions, they do not have to file another application, and they will be notified of potential PUA eligibility and any action needed. It's very, very important for people to file their weekly certifications. Through that weekly certification process, those that have already filed for PUA will get some additional questions asked that will then help them to receive their PUA benefits. So Mr. Elliott said earlier, we can add, and we will do our dead level best to do whatever we can to help people draw the benefits that they are entitled to. have added and will continue to add phone lines if necessary. But if we all call the same lines, and I tried to call that line this morning, and I did get through. So it's things such as that. It's like me calling in and checking to see, or someone having all the numbers called at one time. I still say the best way to file is self-service online. I'm sitting here and listening to Dr. Dobbs and Governor Reeves talk about the health community and the response from that part of the COVID-19 response effort. And I also feel for unemployment and all the programs that we offer, plus the CARES Act, that we should help our neighbors. A community effort for those who know a little bit more about unemployment. A couple of other things. If you have not filed a claim for unemployment benefits since you've been off work to COVID-19, a claim should be filed, and understand that this is the way that we were told by the Department of Labor how it should fall. It will take you through the regular eligibility questions for unemployment insurance, the regular program, and you may even get correspondence that says you do not qualify for that. It will then get you to the questions for the pandemic unemployment determination. So you will get pieces of correspondence either through the mail or through when you enter your username and password for your account that tells you different things. So there will be a denial for unemployment and then an eligibility determination for the pandemic unemployment assistance. So pay attention to all of it and help others. And we have a host of people on the phone lines. We talk specifically about the call centers and that, but there are volunteers that have retired and volunteers from other agencies, our partners that are all helping on different teams, not only to help take claims, but to also take these email boxes that we've said to the public, contact us at these email boxes to help bring down that workload. And we've made significant progress in the last few days. It's not enough. It's not enough until we serve every single person, but we continue to strive forward for that. Another point Dr. Dobbs made was, and I wrote it down, about a certain skill set. People ask us, why don't you put more people on? And we are training every day to help people gain a certain knowledge and skill set that is needed to help with unemployment. I said in our first opportunity here to be with you that unemployment insurance is a complex program, and we are trying to weigh as we put people on whether it is a benefit for them to be there, or if they can't answer the questions for which people, or will they become more frustrated that they can't do so. So we've had people that were not experts at all in unemployment insurance 4 or 5 weeks ago and now are training others. So that expertise has grown exponentially in the last few weeks, as well as mine, but we still have to weigh the skill set that is needed for those that will help our Mississippians.
Sure. I have a question for Dr. Dobbs. Meridians, some of the nursing homes in Meridian seem to be having trouble. If they were to clear everybody out, sanitize, who certifies them? Who goes in from the health department, or does the health department go in, say, well, you did all these things, it's fine, or you're lacking, you didn't do this, you didn't do that. What type of certification, what type of qualifications, what criteria does the health department provide so that they know they followed all the rules, done the best they could, and are ready to accept back their clients?
There's a few things in there that are very important elements. Certainly environmental cleaning, those standards are pretty straightforward, and so that's actually pretty good. We have good guidance for them to make sure that they can do it. We probably will be more proactive in that regard as far as taking a more active role. Don't want to say exactly what that is in case it changes, but certainly that's something that's important. But the most important thing about transmission is the people themselves. And you can imagine if you take a bunch of people, some of whom may be asymptomatically shedding, and send them somewhere else for a while, instead of actually protecting people, you've endangered a whole new group of people. So taking care of folks where they are is so very important. I mean, you've got to make sure they're safe, without a doubt. But we are very actively involved, will be more actively involved, especially with some of these assurance pieces. And then I think the testing piece is going to be very important as we are able to ramp up that. It gives us such better visibility of what's going on in a snapshot instant that we'll be able to give them better guidance and directives.
Taylor Vance from Daily Journal has a question. Taylor?
Yes, I have a question for Dr. Dobbs, and I apologize if you've already addressed this today. But do you think that large-scale antibody testing is something that the state should look into to determine how much COVID-19 has spread throughout the state, particularly for people who are carriers of the virus?
Yes, we certainly do need to look at doing, and we're already looking at doing some surveillance testing. We will need to do enough to make sure we get a valid estimate to understand what the likely percentage of folks that have had it before. So that would be a significant number of individuals. There will probably be some utility to serology in the future for certain high-risk occupations, maybe in healthcare systems or somebody who might be exposed, so that we know not only what the likelihood of infection was, but also too who might be immune. So there will be a tool for it, but it's really we don't really know the best way to use it yet in large measure because we don't have a good sense of how accurate it is. And I hate to get into this too much, but if you test too many people, you get more false positives than true positives. And so you've got to be selective how you do it, or you'll just confuse yourself, because they're probably going to be pretty good tests, but they're not perfect tests, and if we misuse them, it'll actually cause more confusion.
Yeah, the data is not conclusive in many ways. For instance, there was a study that came out over the weekend from University of Stanford professor which claimed in a couple of counties in California that as many as 50 to 80 times more people had actually had the virus than had tested positive. Now, there are other studies that put the number much less than that, and so it's just, while I think long-term every single piece is important to this, it's not something that's going to get solved in the next 24 hours. Yes.
You've talked about, that even though the numbers are high for unemployment and the numbers that we've seen filed, that it's obviously not full picture yet as folks still try to get through. Knowing that some folks may have waited till this came online to begin the filing process, what kind of surge are we kind of bracing ourselves for in terms of the numbers of unemployment, knowing that this is now online as well?
Yes, I mean, this is a very large group of individuals. I mean, when you think about self-employed, independent contractors, employed by a church, religious entity, or nonprofit, employed in the gig economy, or those who have insufficient earnings to establish a regular unemployment claim, it's a fairly significant group. I don't know if y'all have estimates or not, but
it's kind of hard to determine because those individuals are not registered, but it's really unpredictable.
The current number that we're seeing could include some of those individuals. They may just have been denied, or does that 140,000 include only those who have filed and been eligible?
Yes, that is correct. The numbers that Director Turner mentioned earlier does include some of those individuals who've already filed and received notification that they're not eligible. And I think we've estimated that number to be about 8,000.
And remember, if you have filed and you fit into those categories and you've already gone through the process, the next thing that you need to do is file your weekly certification, because the system will then ask you questions which will help get you, you don't have to go through the whole process again. File your weekly certification. Additional questions may be forthcoming, and once those additional questions are forthcoming, you can then become eligible. Seeing no further questions, as promised, I'm going to wish a few of my closest friends happy birthday today. To Blake Maggard and Madison Lott and Camden Pounds. Happy third birthday to Lindley Grace Sims, Deja Nicole, to Cheyenne Allen, to Madison Southern, to Corey Leonard, who loves NASCAR and science, to Braden Parker, who is turning 4 and loves the Ninja Turtles. Happy birthday to Rory Dearman and Emma Grace Rocha, to Bella Arrington, who is turning 9. Sarah Portera, Allie Ray Warren. Allie Ray Warren is a huge Elvis fan, so happy birthday, Allie Ray, who loves to sing and dance. Happy number 7 to Dylan Harvey. And happy number 12 to Carly Ray Alford, who wants to attend Mississippi State's veterinary program when she gets older. I know that is a great program up there in Starkville, and it's very hard to get into, so make sure you study hard, Carly Ray. Philip Dell in Meridian, Riley Bailey, Malia Holsey, Jayla Gartman. Happy 14th birthday to Bryce Smith, who's going to be a freshman at Brookhaven High School. Happy birthday to Harper Davis and Haley Ross and Elle Robertson and Ashton Curry. Happy birthday to Dagan Flota, who misses playing soccer with her Gulf Coast United team. She's turning 12. I know we've had the opportunity to play against a number of the Gulf Coast United teams, and they have a great program down there in South Mississippi. Happy birthday to Mackenzie Willis, who loves softball and spending time with her brother, Damien. Happy number 15 to Hadley Lindsay and Marley Foster. Happy 10th to Colton Trimble. Happy Sweet 16 to Chelsea Russell. Happy birthday, Cassidy Hill. Meg Glasgow plays softball for the Mississippi Motion. Happy birthday, Meg. I know you can't wait to get back out on the softball field. Happy birthday to Gabby Grizzard and Angel Lincoln, who's turning 24, and Gabriella McLeod, who is a 4th grader at Brookhaven Elementary, who is turning 10. Happy birthday to Parker, who loves baseball and plays for the Mathiston Mad Dogs. Happy birthday, Ben Blackledge, who's turning 2, and to 2 twins that are turning 3, Charlie and Ellie Meeks. Happy birthday. Jamarcus Minton is turning 15, and he wants everybody to know that he's just not disappointed about not having a party. He just wants his cousins, his brother, and his sister around to help him celebrate. Oh, yeah, and he wants a laptop so he can stay up to date on his schoolwork. Happy birthday, Anna Catherine Hankins, Evan Spooner, Jace Herron. Happy number 6 to Blake Muirhead. Happy number 9 to Cliff Ward. Happy birthday, Ava Meadows, CJ Agee. Happy number 5 to Hudson Kurtz and to April Renee Odom, Reagan Aldris. Happy birthday to Noel Morgan up in Tupelo. Happy birthday to John Adams. Happy birthday to Drew Phillips in Oxford. Tiffany Tardy, who is a social worker for the state, and Tiffany loves it. Tiffany, thank you for your service to our state, and thank you for your service to our fellow Mississippians. Virginia Hollingsworth is a 4th grade teacher. Ms. Hollingsworth, thank you very much for your service. What you're doing is incredibly important, and thank you so much. Happy birthday to James Marlon Hayes, who is turning 9. Happy birthday to Lincoln Orr, who is turning 10. We have twins that are turning 8, Parker and Piper Avery. We got a young person from North Point Christian School, Aiden Hoy, who has a birthday today. Happy birthday to Chris Rhodes in Petal, who is turning 48. And to former state representative Sarah Thomas, happy birthday, Representative Thomas. Finally, we will go and again thank those that have served us in the military and are living in our Mississippi Veterans Home. This time in Kosciuszko, we've got 2 birthdays today. Happy birthday to Jimmy Nolan, who is turning 71 years young, and happy birthday to James King, who is turning 73 years young, again up at the Veterans Home in Kosciuszko. Thank y'all. We're going to get through this together. Continue to be vigilant. Continue to work hard. Wear masks in public. Use good hygiene. And shelter in place for just a few more days. Thank y'all, and God bless.